1. The Black Death, 1347 to 1351. Between 1347 and 1351, a catastrophic plague swept across Europe, Asia, and North Africa, wiping out enormous portions of the population. The culprit was Yersinia pestis, a bacterium carried by fleas on infected rodents, transmitted to humans through a single bite. Victims developed agonizing swollen lymph nodes called buboes alongside high fever, vomiting, and blackened skin, giving the disease its name. 3 deadly forms existed: bubonic, septicemic, and pneumonic, the last spreading person to person through the air. Doctors were powerless, blaming bad air and celestial alignments. Entire cities were abandoned. Some regions lost over half their population in just a few years, reshaping the social and economic fabric of medieval civilization forever. What followed was equally transformative. The sudden collapse of the labor force gave surviving peasants unprecedented bargaining power, accelerating the decline of feudalism across Europe. The Black Death didn't just end lives, it forced an entire civilization to reinvent itself. 2. The Plague of Justinian, 541 to 549 CE. Centuries before the Black Death, the same pathogen, Yersinia pestis, struck the Byzantine Empire in 541 CE. Traveling aboard merchant ships and overland trade caravans, infected fleas spread the disease across the entire Mediterranean basin. Constantinople, the empire's capital, was devastated. Contemporary accounts recorded thousands of deaths per day at the outbreak's peak. The pandemic crippled the military, collapsed tax revenues, and halted Emperor Justinian's ambition to reunite the Roman Empire. It is considered one of the pivotal turning points of Mediterranean history. A plague that didn't just kill people, it killed an empire's future. The Justinianic plague also opened a power vacuum that would reshape geopolitics for centuries. As Byzantium weakened, rival powers, including the early Islamic caliphates, expanded rapidly into territories the empire could no longer defend. 1 bacterium, 2 pandemics, and the course of Western history altered twice. 3. Smallpox. Caused by the variola virus, smallpox was one of the deadliest diseases in human history. It spread through respiratory droplets and contaminated materials, then invaded multiple organ systems, producing a horrifying rash that progressed from spots to fluid-filled blisters, leaving permanent scarring on survivors. The fatality rate hovered around 30% and could reach catastrophic levels in unexposed populations, as seen during European colonization of the Americas. No cure existed. Indigenous civilizations were devastated. Then came Edward Jenner. In the late 1700s, he proved that cowpox exposure could protect against smallpox, laying the foundation for all modern vaccines. In 1980, the WHO declared smallpox eradicated, the first human disease ever wiped from the face of the earth. What makes this story extraordinary is the scale of coordination it required. Over 2 decades, thousands of health workers tracked every case across more than 30 countries, vaccinating entire communities in some of the most remote regions on Earth. It remains the single greatest collective achievement in the history of public health. 4. Tuberculosis. Tuberculosis, caused by Mycobacterium tuberculosis, spreads through the air every time an infected person coughs, speaks, or breathes. Once inhaled, the bacteria can lie dormant for years before striking. Malnutrition, stress, or a weakened immune system can reactivate them at any time. Active disease brings a relentless cough, blood-tinged sputum, night sweats, weight loss, and progressive lung destruction. It thrives in overcrowded, poorly ventilated environments: prisons, refugee camps, urban slums. Treatment requires 6 months or more of antibiotics, and skipping doses breeds resistance. Today, drug-resistant TB is one of the most alarming public health threats on the planet. Throughout the 19th century, TB, then called consumption, claimed the lives of artists, poets, and composers, earning a dark romanticism in Western culture. But behind the literature, it was a disease of poverty and inequality. It still is. 1/4 of the world's population carries the latent infection right now. Malaria. Malaria is caused by Plasmodium parasites delivered through the bite of infected female Anopheles mosquitoes. The parasites travel to the liver, mature, then invade red blood cells. triggering wave after wave of rupture and reinfection. The result? Cyclical episodes of violent fever, chills, and sweating. Without treatment, malaria can progress to cerebral malaria, severe anemia, coma, and death. Young children and pregnant women face the highest risk. Despite decades of progress, bed nets, insecticides, anti-malarial drugs, malaria remains endemic across tropical regions. Drug resistance continues to complicate control efforts, keeping this ancient disease very much alive. Malaria has also shaped human genetics in profound ways. The prevalence of sickle cell trait in populations from malaria-endemic regions is a direct evolutionary response to the parasite, a genetic adaptation forged over thousands of years of coexistence with one of humanity's oldest killers. 6. Measles. Measles is one of the most contagious pathogens ever identified. The virus lingers in the air for up to 2 hours after an infected person leaves the room. It spreads before symptoms even appear, and making containment exceptionally difficult. After fever, cough, and conjunctivitis, a characteristic rash spreads from the face downward. But the most dangerous consequence is invisible. Measles wipes out immune memory, leaving survivors vulnerable to infections they had previously conquered, sometimes for years. The vaccine, introduced in the 1960s, is highly effective, but requires over 90% coverage to stop outbreaks. Wherever vaccination rates drop, measles comes back fast. This immune amnesia effect is particularly alarming because it means measles doesn't just kill directly, it sets the stage for secondary infections to finish the job. Studies estimate that measles may have been responsible for nearly half of all childhood deaths from infectious disease throughout history, long before we understood why. 7. HIV/AIDS. HIV targets the very cells designed to fight it. CD4 T lymphocytes, systematically dismantling the immune system. Transmitted through blood, sexual fluids, and breast milk, it can silently replicate for years before symptoms emerge. When the immune system collapses, AIDS develops, leaving the body defenseless against infections and cancers that a healthy immune system would easily defeat. Tuberculosis, pneumocystis pneumonia, Kaposi's sarcoma. There is still no cure. But antiretroviral therapy has transformed HIV from a death sentence into a manageable chronic condition, provided patients have access to it. That access gap remains a global crisis. The social impact of the AIDS epidemic was equally devastating. In the 1980s and 90s, entire communities were dismantled by stigma, silence, and government inaction. The fight against HIV forced a global reckoning with inequality, healthcare access, and the politics of who gets to survive a pandemic, questions that remain deeply unresolved today. 8. Ebola. Ebola is visceral, fast, and terrifying. The virus spreads through direct contact with the blood or bodily fluids of an infected person, including the deceased. It attacks blood vessels and the clotting system simultaneously, causing internal hemorrhage and multi-organ failure. Early symptoms mimic flu: fever, headache, muscle pain. Then comes vomiting, diarrhea, rash, and in severe cases, uncontrolled bleeding. Case fatality rates have ranged from 25% to over 90% depending on the strain and available care. Outbreaks have been concentrated in Central and West Africa. Containment depends on rapid isolation, contact tracing, and community trust. Because in areas with historical reasons to distrust health authorities, fear can spread faster than the virus itself. The 2014 to 2016 West Africa outbreak was a wake-up call for the entire world. Over 11,000 people died, and the global response was widely criticized as too slow and too fragmented. It exposed just how unprepared even modern health systems are when a hemorrhagic fever ignites in a region with fragile infrastructure. The 8 diseases covered in this video are more than medical case studies. They are chapters in the story of human civilization. From the plague of Justinian to HIV/AIDS, every epidemic reshaped societies, toppled empires, and forced medicine to evolve. Each crisis produced breakthroughs, vaccines, antibiotics, antivirals, all born from necessity. Yet several of these diseases remain active threats today. Drug-resistant tuberculosis, malaria in the tropics, and Ebola in Central Africa remind us that the fight is far from over. The conditions that allowed these pandemics to spread, overcrowding, inequality, poor sanitation, global trade, haven't disappeared. Understanding the past is how we prepare for what's coming next. If this video taught you something, hit like and subscribe. It genuinely helps this channel reach more people. Which disease surprised you the most? Drop it in the comments. See you in the next one.